honored Dr. Joseph Burrascano.
Dorian, thank you so much. And everybody, thank you for tuning in and thank you for admitting me to your home tonight. I'm talking tonight about Bartonella because, you know, in the world of Lyme disease and tick-borne diseases, I think Bartonella is actually one of the worst, if not the worst one that we're dealing with right now. It seems to be early on in our knowledge of Bartonella, but it's such a complex illness that I think we're going to spend a lot of time just going over the details, make all of you experts. Everybody ready? All right, so why is Bartonella such a toughie? First of all, it's not just one germ. Every time I look up the literature, we find more. If I talked to you last year, we talk about 25 or 30 Bartonella. Now there's over 40 that are recognized. And it's considered a stealth pathogen. It can live inside our body cells and hide from the immune system and from treatments. It can also be found in the skin and pretty much every other organ. And it's not only found in people and fuzzy mammals, but even birds. Another thing that's very important, and we'll talk about this more later, it makes biofilms, that slimy layer that germs can secrete and then hide within. And germs that are in biofilms are much more resistant to treatment. A study with Lyme in biofilms showed you need 1,000 times more antibiotic to try and kill the germ through this protective biofilm. Also, a lot of testing is done on the germ, and if it's encased in the biofilm, you don't see it. So that's an important thing. Besides tick bites, you know, you can get Bartonella from other things. Different types of ticks, fleas, mosquitoes, biting flies, mites, even one report from a red ant. You can get it from cat scratches.
Hey, Dr. Burrascano, I think you need to unmute. Somehow you get muted.
All right, can you hear me
There
now?
we go. Yep.
All right. Sorry, everyone. I was just saying that Bartonella has got a worldwide distribution. This is just one article. I had to put this on the map. They're found way up here in foxes and fleas from the bird nests, way up here. Now, if you zoom out, which I did here, look where it is on this. It's way above the Arctic Circle. Like what animal, what anything can live up there? It's obviously something, including Bartonella. So that's not fun. All right, so let's talk about this. It's not just the Arctic. This is a map developed by the lab IGenix. And what they did was they kept track of which counties in the United States they found positive tests from. So this is basically the minimum of what you'll see because there are places where people just didn't get tested yet. But pretty much, except for Nebraska, it's been found in every other state. And of course, as you can see, your state as well. Bartonella has been called cat scratch disease, but that relates to just one of the 40 plus species. They have names hard to pronounce as Hensley, Quintana, Elizabethae, Washoensis, Vinsonii, cholerae, and on it goes. So it's kind of a complex group of bugs. And you don't have to know all the details, but just to emphasize how many different species of Bartonella there are. And look, cats, dogs, human, horses, cattle, rats, bats. I mean, you know, it's a zoo full of people or of vectors. So now here, it's been thought that if you look in textbooks, you can't get Bartonella from a tick bite. But the thing is, we see so many people who have Lyme and were completely well until they got the Lyme. And when they got the Lyme, they also got Bartonella with it. So the suspicion was that, you know, maybe it really came from a tick bite. And the dogma was that it didn't, but because nobody looked. So can you get Bartonella from a tick bite? The answer is definitely yes. And here's an article where you can find it in the ticks. You can find it actually in people. You can find it in skin biopsies and lymph node biopsies of people who got tick bites and got it. Another thing is that it can be transmitted not just through the tick as a vector, but the thinking is that it probably can be transmitted very rapidly. the dogma of Lyme disease is that it doesn't live in the mouth of the tick, it lives in the stomach, and the tick has to be attached for a number of hours before the tick will regurgitate and make you sick. It's sometimes true, sometimes not. In the case of Bartonella, it's been known to exist in the salivary glands, in other words, the mouth parts of the tick. So obviously, very quickly after a bite, it's possible to get infected. So if someone says, gee, the tick was only on me a short time, maybe a few hours, I couldn't have done anything, but it's not true. As long as the tick bit you deeply enough to get to your bloodstream, the risk is that it did transmit a germ like this if it had it in it. Now, I want to talk about the presentation of Bartonella because it sort of gets mixed up in the fog of Lyme disease. But let's just go through this came from an article from Ed Breitschwart, who's a real genius and a really nice person. So patient 1, college student, received a severe cat scratch on her right hand, resulted in a red raised nodular lesions, which was diagnosed as cat scratch disease. 1 year later, she had fatigue, headaches, memory loss, disorientation, insomnia, poor coordination, tremors, and infrequent petemoral seizures. Well, the title of this article I took this from is a neurological presentation of Bartonella, and I want to emphasize that. Again, case number 2. Person developed debilitating depression, insomnia again, fatigue again, loss of coordination, memory loss, disorientation, headaches, continuing over a year. 3rd person, acute febrile illness, malaise, and then it seemed to get better. And then the next few months, neurological symptoms, stumbling during jogging, muscle weakness, fatigue. They thought it was a viral infection causing damage to the nerves. But during the next year, things got worse. He could no longer jog and run, couldn't even walk without assistance. And he had to rest several times a day. And they diagnosed multiple sclerosis. How do you like that? And we know that this, in fact, wasn't. It was Bartonella. So again, we're talking about neurological presentations. The quote is fatigue, insomnia, memory loss, and/or disorientation, blurred vision, loss of coordination, headaches, and depression were the most commonly seen symptoms. Now, if you stop for a second and think about Lyme disease itself, well, people with Lyme, Borrelia Lyme, they have fatigue, they get insomnia, they get memory loss, they get disoriented, they can have trouble with their vision, they can get coordinated with nerve troubles, definitely headaches, definitely mood disorders. So that's the problem. Here we have a germ totally different than those that cause Lyme borreliosis. Totally different germ, different testing, different treatment, yet the symptoms overlap. And this kind of emphasizes why it's so important, and why I'm doing this tonight is to tell you about some new testing that's come along. Here's another one: seizures, severe paresis, which means paralysis or weakness. Debilitating migraine type headaches are the predominant abnormalities in 3 of the patients. Again, very much like Lyme disease. 2 patients reported fatigue with accompanying neurological abnormalities that persisted for 3 to 5 years. So another dogma you'll read, which is not correct, is that you get this and you get over it and you're fine. Well, here's someone in the article, 5 years. So what's the clinical picture? First of all, and this is what I tell the physicians I teach, the main thing about this is symptoms of the central nervous system that out of proportion to the other physical symptoms. So for example, if you're someone who has Lyme disease and he or she has joint pain and the headaches and the fatigue and so forth, but the joint pains are mild and minimal, there's no real swelling, but he's got a lot of central nervous system problems that are way out of proportion to what the Lyme itself is. You have to start to think of a germ like this. It really seems to attack the nervous system. And the main thing is that the CNS, the central nervous system, is really irritable. It's like as if you drank 10 pots of coffee. Anxiety, panic attacks. Some people, especially younger people, go into rage attacks. And there have been articles where people postulate that some of the people who are performing violence in crowds and so forth may be infected with Bartonella, not an impossibility. Again, this irritability, insomnia, depression, tremors. I've had people who were patients of mine diagnosed as having seizure disorder, and some were told they had pseudo seizures because they couldn't find seizures when they were tested, but the people were shaking and having these attacks. And it was Bartonella. Ataxia means a stumbling kind of a gait, dementia, the forgetfulness, hallucinations, even schizophrenia when the brain infection gets bad. Another thing that you see is antisocial behavior. I mean, I've seen children, teenagers, late teenagers do things that they would never do otherwise. Good kids who got sick and they end up stealing cars and and doing all sorts of antisocial things. I don't want to get into the details, but you get the idea. It's something that's attacking the brain, causing behavioral changes. The second finding that doesn't happen in everybody, but it's very, very characteristic, is in the skin. The thing that's really peculiar are what are called Bartonella tracts. They look like stretch marks. I'll show you a picture. And also you can get red scabbed bumps that look like as if someone was picking at their skin. Another thing about the skin, you know about the condition called Morgellons or Morgellons, where people get these open sores that weep and can have filaments come out. The people who are experts in this find that pretty much everyone who's got this with Lyme disease also is co-infected with Bartonella. So once again, there's a skin component to this whole thing. So pictures, these are the red bumps. It's called bacillary angiomatosis. That's a good Scrabble bunch of words. The red bumps, they may scab over. They're always sore. When one goes away, another will come out. And here are the things that are called the tracts. They resemble stretch marks, but there's certain differences. Let me just move this away. They look like stretch marks, but they don't follow the planes of the skin. Like here in this picture, they go up and down on the person's body. The skin planes go around the waist. And try another one. Here under the arm. Now this, you say, well, stretch marks, someone had gained a lot of weight and lost it. Well, no, this person did not, number one. And number two, these are not following skin planes. Here are the skin planes along there. You can see the skin folds under the arm, but look, it's going up and down. Across the back, this looks like someone leaned against, a lawn chair or something. And here's a person who has both the bumps and the stripes. Okay, so the clinical picture, other clues. Temperature elevation. I've always noticed that in my Lyme Borrelia patients, often their temperatures are below normal in the morning, like 97 or so, but by mid to late afternoon, they start to go up higher, maybe 99, 99.2. With Bartonella, that seems to be reversed. They wake up with a 99.2, 99.3 temperature, which can persist or go away during the day. So that's kind of opposite from Lyme. Night sweats are possible, not to the big degree you get with babesiosis, but light night sweats have been reported and are possible. General things, headache, neuropathy, that's the numbness, the tingling, the burning, the buzzy feeling, and the fatigue. Connective tissues. Unlike Lyme, which really attacks joints, Bartonella attacks the tendons and ligaments. And so if you have Bartonella and you run your fingers firmly like down the outer thighs or outer portion of the elbows, you can feel these tender skin nodules just underneath the skin surface. Likewise, in the feet, they cause the soles to be sore. One of the things you hear all the time in a Bartonella patient, so when they get up in the morning, the bottom of their feet is very sore, and they have to like hobble around it and limp a little bit, until they start to move a bit, and then the pain calms down. So it's more of a tendon and bone type of pain as opposed to the joint symptoms of Lyme specifically. And the joints can be painful for sure, but the pain is without the kind of swelling you see in Lyme. Another big target for Bartonella is the GI tract. It can cause gastritis, just like H. pylori, heartburn, and even lower abdominal pain because it infects the lymph glands that line the internal organs. Another final big part of Bartonella is effect of the eyes. It's notorious for causing inflammation in pretty much any part of the eye, from the cornea on back to the retina, even involving the artery and even the vein that give the blood supply to and from the eye. So again, central nervous system, which includes the eye, GI tract, and tendons and ligaments more so than joints. And the other clue, which really got all of us started on this, I don't know how many 100 years ago, was an unexpected reaction to Lyme treatments. Now, when I said this, it's because before we really knew what was going on, we would have Lyme patients who went on antibiotics and they went through the treatments, and over time they improved, but they improved only to a plateau and didn't get completely over it. It was like kind of a partial benefit. And then what happened is, if you said, well, you're kind of on a plateau, let's stop and give things a break and reassess. If Lyme were the offending organism, Lyme germs grow slowly. It takes some weeks to start to generate, and they regenerate once every 4 weeks, which is a classic 4-week up and down cycle of Lyme. Now, if you have someone on Lyme treatment and you stop treatment before they're over it, what happens is, for the first week or so, they actually feel better. They're off the antibiotics, no more Herxheimer. But with Lyme, over a period of 3, maybe 4 weeks, they start to gradually get worse, and it's always back. But with Bartonella, it's totally different because they grow much more quickly. So if you have a Lyme patient and you stop the treatment, and within 4, 5, 6 days, they're sick again, it can't be Lyme Borrelia doing that because it doesn't move that quickly. So that's a really strong clinical clue. And that's what happened in the very early days, back in the 90s, when we said something else is going on here. As it says in the slide, Lyme growth is measured in weeks, Bartonella is measured in days. So between these symptoms that come and go rapidly with treatment, and the fact that the temperature record is kind of opposite from Lyme disease, again, the recommendation I always give, and especially here, is have you all as patients keep a symptom diary and a temperature diary and see if there's a pattern to the symptoms that are coming and going every 4 weeks, like with Lyme, or maybe without a pattern, or starting and stopping very rapidly with treatment changes, and also looking for that temperature elevation in the morning rather than the afternoon. All right, so crazy clinical picture, very hard to sort out from the other tick-borne diseases. So the lab is important here. So the lab tests available are PCR, that's the DNA amplification type of testing. Serologies, those are the immunoblots, IFAs, ELISAs, Western blots. A FISH test, I'll talk about that, a fluorescent in situ hybridization, and a T-cell assay. So these are what's available. We're going to go through them one at a time. So PCR for Bartonella is available, but they're not very sensitive. There are a number of things in our bloodstream that interfere with this PCR reaction. And even if those things can be accounted for, which often they can't, the other problem is that when Bartonella is in the bloodstream, it's there in very small amounts and it's present embedded in biofilms. So the sensitivity of PCR is low. Look at the first bullet point. In this study that was printed, published in 2020, they found only 6 out of 112 confirmed patients showed a positive PCR. That's 5% sensitivity. So that means 95% you get a false negative. So PCR is not so great. So they've tried to improve the PCR. There's a thing called a droplet digital PCR, ePCR, which is a definite advance on this. It's a test only for the blood, though. You can't do this on tissue biopsies or joint fluid, spinal fluid. But what they do is they put a fluorescent probe into the blood, not in your blood, after they draw it out of you. And then they break this up. The blood drops into teeny weeny drops, a nanoliter, and each individual drop is then scanned for this fluorescent probe. And the results of this found the sensitivity is increased 6 times over the straight PCR, giving it a 30% sensitivity. If you went all the way out and included all samples where they drew the blood and tested it, and then what they did was they would draw 3 separate blood tests on, like, usually a week apart. And then some of these were put in a blood culture and let the culture for up to 21 days and sampled 3 different times. So taking the blood 3 times, culturing it, and then 3 times more doing it, they got the sensitivity up to 47%. So still, again, you're less than a coin toss. So yeah, PCR is out there. It's not the best test. Now you can do a Bartonella serology test. Usually they do IFAs in America and Europe. You can get an ELISA. The problem with this, just like all the other serologies, is you have to have a serology for the species that you're testing or you're looking for. So when you get an IFA, or if you're in Europe getting an ELISA, you're testing for one species, the cat scratch one, which is Bartonella hensleyi. Sometimes you can get the Quintana, but usually it's just this one species. So let's say out of these 40, you don't have this. You have species 32 or co-infected species 21 and 16. I'm just pulling numbers out of my hat. You're not going to pick it up. You're going to get a false negative. Now, even if Bartonella hensleyi is there and you do this test for it, the sensitivity range from as low as 28%, which is like, a quarter of the tests. Some got as high as 91%, which sounds good. Those were in patients who had an infection of the lining of the inside of their heart and on their heart valves and swollen giant lymph glands. So these are people who are really, really, really sick, probably had immune deficiency too, or some other problem that made them get this sick. And then the test got more sensitive. Hopefully you guys would get much better testing before you get to that point. So here's a case series that was published. Again, Dr. Bradshaw published this. 6 patients, they all had severe neurological dysfunction. They were diagnosed clinically because the testing was negative, but eventually by repeated testing, they were confirmed by PCR. However, 3 of these 6 never ever got a positive serology. So confirmed cases, clinically diagnosed, confirmed with the PCR, half of them never got a positive serology. Here's this patient 3, 6 times tested, all the samples are negative. This one's tested 3 times, all of them negative. This one tested positive 1 time after many, many blood draws. Now, if you, let's say, had 6 blood tests and then 7 was positive, the average doctor, rightly so, would say, 6 times you got a negative, 1 time a positive. I would believe 6 negatives over 1 positive. And with the serology, you really can't tell because the sensitivity is so low. They're also not very specific. What does that mean? That means that you can get a false positive Bartonella serology from other infections and not even have Bartonella. The most commonly reported ones are chlamydia, which can cause ear infections and in some cases pneumonia and so forth. I forget the exact numbers, of something like 37% of the time it was chlamydia, not Bartonella, causing the positive test. Epstein-Barr virus, cytomegalovirus, Coxiella, which is another bacteria, strep pyogenes, the thing that causes a strep infection. These have all been shown to be causing a false positive Bartonella serology. Also tularemia, which is another tick-borne disease. Toxoplasmosis can give a false positive on your Bartonella testing. So the serology is really not such a great test either. So why are these serologies not doing so well? Well, there's familiar stories. Number one, as I said before, there are over 40 species, at least 13 of which we know can infect people, make them sick. But the standard serologies like you get from the big labs are validated for just 1 species and usually 1 serotype of that species. Some of these germs have several different serotypes within the species. So if you don't test for all of them, you're going to run a risk of missing it. The other thing is that the Bartonella can evade the immune system. And this is one of the reasons why they won't get a positive serology with these standard tests that are not very sensitive. The other reason is that there's always a trade-off in serology between sensitivity and specificity. So if you have a blood test and you get a number on your test, on your ELISA, on your IFA, they give you a number. Well, what determines if that number is a positive test or a negative test? They give you what's called a cutoff. If it's above 40, it's positive. Below 40, it's not. Well, you can play with this cutoff value to try and change the accuracy of the test. So, for example, you can lower the cutoff and say, well, 35 would be a positive. Well, then get more sensitive, but less specific. You start picking up things that aren't really Bartonella, and it's giving you false positives. So you say, I don't want that. I don't want a false positive. Let me raise the cutoff, make it 45 or 50. Well, then you're going to have, less false readings, but you're also going to lose sensitivity because you're not going to pick up some of the cases with a mild serology. So that's always a trade-off. There's no way of getting around that with the standard serology. So what the lab in California, IGeneX, did was they developed a Western blot, which just like in Lyme disease, a Western blot is better than an IFA. Their panel included 4 different species, and it was the most sensitive and specific test for Bartonella that had been available. And even now, doctors really like this test because it's better. But they went beyond that now at that lab, and they developed a new test. It's not a Western blot, it's called an immunoblot. And it's so dramatically better that I want to spend some time on it. So what are the advantages? Number one, it's been designed to pick up a lot of different species, not just 1 or 1 serotype, but a lot of different species. Pretty much, from what I've seen clinically, pretty much all the species that are known to cause trouble in the human patient. Because of the methods they use, and I'll go into this in a moment, very, very highly sensitive, much more than that 40% or 30% you see with the standard PCRs and serologies. But the other thing is, there's no longer that trade-off between sensitive or specific and changing cutoff values because there is no cutoff. It's a computerized test. So it gives you very high specificity. So in the case, I'll show you the statistics here. You get a positive on this, it's a positive. You're not thinking, well, maybe it's toxoplasma, some other thing causing a false reading. Now, this testing came about because a couple of years ago, the lab developed an immunoblot for Lyme disease, revolutionizing the way Lyme was diagnosed. And they found, because of this, that there are other Borrelia out there, relapsing fever Borrelia. I've lectured on this as well. And they found there are a lot of these that people didn't think patients had, but they did, thanks to this better test. And now they have it for COVID, the SARS virus. And I use that a lot with my circle of people because it gives you information that no other test can give you. And so with all these advantages, what the lab did was they applied this technology now to Bartonella. So what is an immunoblot? Well, it is a serology, but it's completely different. It uses highly purified lab-created recombinant proteins as the test antigens. Now, what does that mean? let's say you're doing a Western blot. How do you create a Western blot if you're a laboratory? What you have to do is you have to take the germ that you're concerned about. In the case of Lyme, let's say it's Lyme Borrelia. In the case of Bartonella, it's obviously Bartonella. What you have to do is you have to grow it in a culture. Not all these germs can be grown in culture, number one. And number two, you can't get all these 40 different species from some supply house and say, I want species 28, and we're going to put it in a culture and grow it. So first of all, you have to be able to grow these things in cultures. You have to have available the different species you want to do. So once they're growing in a culture, they have to then be concentrated and put through a machine to break them up into tiny fragments and put in through the lab test that way. The problem is that you're going to get fragments of germ that are not relevant to your testing. You're going to get contaminants and a whole bunch of other things that limit the accuracy. Here, instead of that, they make lab-created recombinant proteins, and they don't have to rely on a soup of germs that is not always reliable. So again, this increases sensitivity without sacrificing specificity. You get that trade-off. You don't have that trade-off. And again, this, because you can use these proteins, these recombinant proteins from a lot of different strains and species of Bartonella, you can now diagnose a lot of them. And that's really what's key. All right, so what is a recombinant antigen? They're synthetic antigens created in the lab, identical to what you find in the actual germ. And that's why it's much less of a chance you can get false positive picking up non-Bartonella proteins. At the same time, why they're more sensitive. And why they can actually pick up things that others have not. And it's kind of reverse engineering. I don't want to get too technical here, but basically what you do is, if you know the segment of DNA within the germ that makes the surface protein, the antigens that you're looking for, you take that DNA, you clone it and hybridize the gene, you put it in other bacteria in these big vats, and those bacteria will synthetically create these recombinant antigens. And then you use them rather than fragments of a germ culture, and you make the test out of that. It's much, much more accurate and precise. Also technical things about this that I'll show you. So by choosing these carefully, you can get multiple species on the test, not just one or two. And for example, you can get Bartonella bacilliformis and cholerae, which right now you can't get testing for with any other lab. And if you do get a positive test, the immunoblot can tell you whether it's Hensley, Quintana, Elizabethae, or Vinsonii. If it's one of the other species and not these, it will still show positive and say it's a Bartonella there. We know that it's a Bartonella. Can't tell exactly which one, but we know it's a Bartonella. So what they do is, instead of using one antigen, like one germ, like Bartonella Hensley, they're using multiple to increase sensitivity by using antigens that are specific for this germ. They're much greater with specificity. Now, let me back up a second. What does that all mean? Let's say doing a Western blot for Lyme disease, and you get band like 41. Well, band 41 is positive in Lyme, but it's also positive in syphilis and the spirochetes of the mouth. Let's say you get band 31. Well, band 31 is also found in viral infections like Epstein-Barr virus. So just having a positive band on the test that's not an immunoblot doesn't necessarily mean you have that germ. It could be something else. With an immunoblot, because these are lab-created specific things by DNA hybridization, all that fancy stuff, if you get a positive, it's a real positive. It's very specific. Now, the other thing is, again, getting technical here, if you do a test like a Western blot, when you fragment up these germs that you've cultured, and you put them on a test strip of paper, and you subject them to an electrical charge, and the different proteins in this soup spread out on this piece of paper in different areas, and where they spread is relationship to how heavy a molecule it is. So it's all very imprecise. Where they end up after you do all this shows up as little bands or stripes on the piece of paper, and you say, well, if it's in this position, it's probably this antigen. So it's, you know, it's well worked out, but it's not very precise. The difference here with an immunoblot, though, because they have these specific proteins, not just some soup of germs, they actually put it in a printing process, just like, you know, your inkjet printer. It sprays them exactly in the exact right amount, in exactly specific spots, and there's none of this electrophoresis or germ soup that you have to try and figure out. Because of all this, it's basically replaced all these other tests. I'm giving you a comparison. Over here on the left, this is a Bartonella Western blot, but actually it's 8 different Western blots. And these 8 different Western blots are represented by this one immunoblot here on the right. Again, go back to the left. These are the bands I talked about. These represent individual components of these fragmented germs that spread out on the paper when you give electrical charge. And where they end up is based on how much charge they have, how heavy they are, and so forth. So it's all very vague. And you see right here, they don't exactly line up. It sort of goes uphill here. And some show up, like these are dark here. You don't see it on this. I mean, you know, what's going on here? However, immunoblot, here they are. They're very clear, very clear, very clear. They're not all spread out and hard to decipher. Here's another series of it. Shows you there's positive controls, negative controls, and positive tests, negative tests. I mean, a negative here, completely negative. Positive, you can clearly see it's positive. I mean, it's so much more clear. It's like no comparison. So another study was done to compare how good a Western blot is compared to this new test, the new immunoblot. And so here's 4 patients. The first patient was negative on the Western blot. And again, the Western blot is still, has been until now, the very best test for Bartonella. And here, negative on this, but positive, not only positive on the Bartonella immunoblot for both IgM and IgG, but also showed as Bartonella elizabethae and Vinsonia. So you had not only a positive where otherwise you didn't, but now you can tell which species are there. And this patient was co-infected with 2 different species, which is not that rare. That's been reported a number of times in literature. Here's another patient. They found Bartonella species and 1 elizabethae. Here they found that the second species was in fact Vinsonii. Here again, patient 3, they found a species on a Western blot, but here in the Bartonella ImmunoBlot, they found it was not only a species, it was a positive, but they found 2 different ones, co-infected. Here, 4th patient, negative on the Western blot, positive on the immunoblot. So again, we're finding a much more sensitive test, picking up even better than the Western blot, which had been the gold standard until now. So you say, all right, how specific is it? Well, here's a study with other tick-borne diseases. People with Lyme disease, Borrelia burgdorferi, did Borrelia burgdorferi with tick-borne relapsing fever, Lyme Borrelia plus Babesia, Anaplasma, controls, Babesia itself. In no case did any of these infections cross-react and give you false positive in the Bartonella. So again, say, gee, I have Lyme disease and I got a positive on this Bartonella immunoblot, maybe it's just, you know, a cross-reaction from my being so sick. Well, no, it doesn't do that, and this proves it. And here they took that and extended it with 46 patients now, and these are people who they know had Bartonella, confirmed by a FISH, an IFA, Western blot, all the different ones. And in every case, when they were positive, the Bartonella was positive. So, I'm sorry, the immunoblot was positive. So this one immunoblot was as accurate as doing a collection of these other tests. When you go through the numbers, the specificity was 100%. In other words, a positive Bartonella immunoblot means it's Bartonella. Doesn't mean maybe it's, you know, Babesia going on or a cat scratch or whatever. And positive is positive. And the sensitivity by IgM was 75%, IgG 88.9, and either one being positive became 100% sensitivity with these test samples. So it's light years ahead of the other tests. And basically, if you're going to do a test for Bartonella, this is where you start. Another Bartonella test I want to tell you about is the FISH test, the fluorescent in situ hybridization assay. It's a lot of words, that's why I call it FISH. It's much easier. So what is this one? This one, unlike a PCR test, which looks for DNA, this looks for RNA. RNA is interesting because RNA is a very labile molecule. If it's made by the germ and the germ is killed, the RNA disappears right away, within minutes to hours. Unlike DNA, which can persist for a long time, you can find DNA in mummies, for example. So obviously that's a compound that can stick around. So if you have a test like this, the FISH test that looks for RNA, a positive means a person with that positive test is infected the very time that the blood was drawn. So it's very, very good for picking up an active current infection. And they actually do this manually. What they do is they take the patient's blood, they put it on a glass slide, make a smear of it, and they use specific stains that react with the specific RNA of the Bartonella, and then look under a microscope and take a picture. So you actually can see it with your own eyes, and there it is. I'll show you a picture. Now, the big thing about this, and why I bolded it out, this is the one test that can detect the Bartonella even when it's in a biofilm. PCRs have a risk of not being able to do that. The drop of digital PCR, I don't think that's been reported. I don't know if it can pick that up. Usually it doesn't. I don't say that. I don't think it can because of the technique. but the fish can do that. Now, because this can be designed to detect Bartonella in general, not just one or two specific species, but the general genus of Bartonella, it can be picking up all these other species. It's been validated to get Hensley, Quintana, Vinsonia, and others. But if you have one of the other Bartonella other than these, it'll still pick it up. They just won't be able to say which specific one it is because it's the genus of Bartonella, not specifically a species. So again, very broad coverage for when you have more than one Bartonella, one of the more unusual ones. And here again, pictures. Here's patient one on the left. These little green dots, those are the bloods, the Bartonella that are actually stained with this fluorescent dye. You can see it. Here's another one here. You can see the little germy things. And here's another one over here. On the bottom, that's a negative control. So you can see there's a big difference that a positive is a positive and negative is a negative. I mean, again, you see with your own eyes, the picture's taken and it's there. And you know, you can say, well, how do I know these are just flecks of dye that got stuck to some schmutz in the blood? Schmutz is a medical term. Well, what they did was they confirmed each one of these with DNA sequencing and RNA sequencing. And in fact, proven that really was that and not just some dirt on the slide. In terms of the performance of the fish, the specificity study, 100% specific. In other words, they looked in people who had Babesia, Borrelia, Plasmodium, which is Plasmodium is malaria, trypanosomes, a parasitic disease, Anaplasma, Ehrlichia rickettsias. None of these infections showed up as a positive fish test because again, it wasn't a germ you're picking up, you see with your own eyes. And in terms of inclusivity, whether it was Vinsonii, Hensley, Quintana, or any of the others, it picked it up 100% of the time. And here, over here, it says Bartonella species. Even an unidentified Bartonella, it was picked up in this, so it's really pretty good. So when to use the fish test? Well, you know, it's a direct test. You find the germ in the blood right then and there. Now, that's the most sensitive type of test very early in the infection, because early in the infection, the germs are running around, your body's immune system hasn't developed enough resistance to fight the thing off. So early in the infection, you're going to have a high parasite count and a much greater chance of the fish picking it up. Later on, as the progression of infection goes on and the immune system starts to wake up and respond, the number of Bartonella in the bloodstream decreases. So the fish test becomes less sensitive later on. However, very late, like in chronic Lyme, chronic tick-borne disease, when the immune system is low, especially if you're co-infected, the test becomes sensitive again. If someone's immunosuppressed because of being on steroids or some other illness, again, the fish test becomes more sensitive, not less, as you would with an IFA, for example. So it's very useful in very early disease, very late disease, in any situation where there's a poor immune response. And the other test we want to talk about is called the IgX spot. It's a T cell response assay. Now, what is that? Getting technical here. Well, backtrack. The body has two main parts of the immune system, the B cells, which make antibodies, and the T cells, which are like the Pac-Man that eat them up. B cell tests are based on measuring antibodies because that's what B cells make. And as I showed you before, sometimes it's not so great. On the other hand, a T cell test will see whether your T cells will respond if you subject the blood to a sample of Bartonella. Now, the beauty of this, again, like the other I just talked about, it's specific not for the species, but for the genus. So it can detect all the different subspecies, Hensley, Quintana, Vinsonia, and the others, and even some unspeciated ones. So again, it's this very broad coverage that's going to help to pick up the infection where other tests would not. Now, the T cell response occurs very early, even sooner than a B cell response. So it's possible in early disease to have a positive T cell test with a negative serology. So it's very good in early disease. It's also very good in late disease if the immune system is low. We usually say a low immune system means low B cells, low antibody levels, but that doesn't affect the T cells, so you can get a positive then. And there are people who've been seronegative repeatedly for Bartonella who are positive on T cell tests. So what I like to recommend to the physicians I train is to do both the immunoblot, which is based on antibodies and B cell response, and this T cell IgX spot. So this way you get a full picture of the immune response to the germ. Now, let's say you do these tests and you find positive on the immunoblot, but negative on the IgX test. Well, it means that the B cells might be okay, but the T cells are weak. and vice versa. So not only is this good for diagnosis, but it also gives the clinician kind of a sense of how your immune system is holding up under the illness. Now, because of that, what's recommended with Bartonella testing is what's called a panel approach, because not every case will be picked up by every test. As good as the FISH test is, sometimes it's negative. As good as the immunoblot is, sometimes it's negative. So when you have someone who's very ill, especially chronically sick, especially co-infected, the best approach is to use not one, but 2 or 3 different types of methods together. Again, B cell dysfunction can make serologies less sensitive, but doesn't affect the T cell IgX spot. It may actually allow the fish to become more sensitive. However, if there's a low parasite load, the direct tests like FISH and PCR become less sensitive, but the immunoblot and the T cell test IgX spot get more sensitive. Very early in disease, less than a month, the direct test FISH and the T cell test are favored. So that's why often we have to do at least 2 tests, the immunoblot and the FISH, and sometimes a third test, the T cell test, to really narrow down what's going on. Now, in this case, remember I showed you a few slides ago that the immunoblot and the FISH tests are very highly specific. They don't cross-react with other germs like viruses and give you false readings. So here, let's say you do 2 tests. Let's say you do an immunoblot and a PCR, and the immunoblot's positive and PCR is negative. In this case, you believe the positive test, not the negative test, because the immunoblot, like I showed you, is very unlikely to give you false positives. So you believe the positive in this case and not the negative. Can't say that about the serologies like IFAs. And one last thing about the panels, the Genix lab, which offers all these tests, they actually offer what they call test panels. And when your blood test is ordered that way, they do a lot of different tests on the sample and they give you a huge discount. So it's definitely worth checking it out. Apparently it's on the website, you can look it up. Now, I'm not going to spend a lot of time on treatments today because that's kind of outside the range of what we're doing. But, you know, my theme tonight is to let you become experts, all right? And more than that, lately, there's been a lot of interest in Bartonella. And, you know, I have to say it's partly political. You know, Lyme has become a political disease, and you can't say that the CDC is wrong and the big universities have their own stake in things, and it's all this political thing. Bartonella doesn't have the politics. So what's happening is that big universities and big labs are doing research, not just on the diagnostic end, as I just talked to you about, but also on the treatment end, things that were never done with Lyme disease and only now are starting to happen 30, 40 years later. So here we go. The treatment of Bartonella is very, very difficult for a few reasons. First of all, as I mentioned earlier, they can be found anywhere in the body, in your cells, out of your cells, in the tissues, in the blood, deep in the bone. You can actually find Bartonella deep in bone biopsies, like unbelievable. Again, they make biofilms. Biofilms protect them from antibiotics. In the case of Lyme disease, you need to have 1,000 times the dose to get the thing killed in a biofilm. Another thing Dr. Sapi did with biofilms, she's like the godmother of biofilms in comes to tick-borne diseases. She developed a Lyme disease Borrelia biofilm in the lab. And if you ever saw, I should have had a picture, I should have showed you. It's a little blob of Jello with the with the germs embedded in it, like your grandmother used to make Jello with the fruit salad in it that everyone hated. Anyway, she tried to see what could she do to kill the Borrelia stuck in the biofilm. And she tried different treatments, different antibiotics, different herbs, different other things. She couldn't really get anywhere. And she even tried Clorox type of bleach, regular household bleach. You know what it did? It burned the surface of the biofilm and made a crust and actually protected the germs inside. So here, even a heavy duty antiseptic like Clorox couldn't even bust a biofilm. So that's news that makes treatment very hard with Bartonella. The other thing about Bartonella, just like they found in Lyme disease 2 or 3 years ago, is that they have what are called persisters, germs that are in a dormant state and can't be killed. Let's talk about that. So a persister is what's called a stationary phase. They go dormant. It's kind of a form of hibernation. And the basic rule of thumb is that antibiotics kill germs when they're growing. They interfere with the growth cycle and the making of cell walls and proteins and so forth. But the germ is dormant, it's not growing, so it can't be killed. So these germs go into a state of hibernation. They call them stationary phase or persisters. They become a persister when the environment they're in is hostile. So for example, if we're talking about a biofilm like found like the slime on a rock in a river, let's say the water level goes down and exposes it to the air. Well, the germs are going to form persisters and resist the environment. They're going to do that likewise when someone's on treatment. They sense the antibiotic or they sense the herb, and they shut themselves down so they can't be killed. When you stop the treatment, if you stop the treatment, these skins can sense that and they wake up and they start growing again and they start multiplying again. So we're talking about a very active and very difficult problem with these persistent germs. And that's a big reason why these germs become chronic. Now with Bartonella, just like Lyme disease, there's a double whammy because they can go into a biofilm and then become a hibernate and become a persister inside the biofilm. So they got two different levels of treatment resistance. So that's why Bartonella is something very, very hard to get rid of. So this is where the politics actually don't exist and allowed people to start to do some very in-depth testing for better treatments for these persisters. So they did find a few things that work, at least in the test tube. I'll go through this. Pyravinium pamoate is a drug that's used for treating pinworms. It's an anti-parasitic drug. Trouble is, it's not something that's ever been tested in animals or in people for this type of an infection. So this is just an interesting thing, but it's interesting and nice because it means that they are doing research. So that's a possibility. Daptomycin is a powerful antibiotic drug. It's an IV drug that has been used in these hospital infections that are like, these impossible to treat infections. And that's been found, at least in the test tube, to work. Again, this has never been tested in actual patients or even in animals. You might have heard about methylene blue as a dye, but it somehow is very toxic to these persisters, will kill them even when they're dormant. I know a number of clinicians have been practicing or prescribing these in their practice, and the jury is out. Sometimes it helps, sometimes it doesn't, but it definitely turns your urine and tears blue, believe it or not. Clotrimazole is an antifungal medication. It's known as Miselex, and it's used in cream form for skin fungal infections, ringworms. It's also used as a dissolving troche. You put it in your mouth, on your tongue, when you have thrush in the mouth. The reason why it's interesting but not useful is because clotrimazole doesn't absorb into the bloodstream, whether you swallow it or smear it on your skin. So that doesn't work. But interestingly, clotrimazole is what's called an azole drug, A-Z-O-L-E. That's how come it says A-Z-O-L-E in the end. One of the physicians I know here on the East Coast uses fluconazole, which is xiflicane, which is another azole, a cousin to this. And he uses that in his Bartonella regimens. And he claims it's been very successful. Again, we don't have clinical data that's been put through clinical trials, or at least, given some formality to see if this really works. Gentamicin is a drug that really works on Bartonella, both the living and growing as well as the hibernating stationary ones. But gentamicin is a tough drug. It has to be given either as an injection that hurts like crazy or as an IV. It can be toxic to the hearing in your ears and also toxic to your kidneys. So this is not very good when you're sick. The other thing, which is actually more important, gentamicin doesn't cross the blood-brain barrier. So people who have very bad infections, let's say someone who's on chemotherapy and they get an infection with some other germ, I'm not talking about Bartonella now, and they need gentamicin, they actually have to inject it into the spinal canal, like do a spinal tap and put the gentamicin in there. So I'm not going to do that for Bartonella. So I'm saying this just so that you know that these things are interesting and they show that the research is happening and it's getting everyone to think. But I can't just have you say to your doctor, quick, give me gentamicin because Dr. B said it works, because this is, again, test tube stuff. It's not something that we can show clinically. Now, again, politically, we can do these things with Bartonella. What they've done is looked at the different herbals, and they found which herbals work against these persisters. And they found a few. Cryptolepis, which is something that's been used also for babesia, has been shown, again, the test tube, and some clinicians are using it now, to be toxic to the Bartonella, especially in the stationary phase. Black walnut hulls, Jugulans nigra, has been also shown to work, as has Polygonium, which is Japanese knotweed. These are, again, test tube studies, not in animals, not in humans. So they're giving us hints. So I'm just giving you some caution here. Another thing, which is very interesting, arginine, that's an amino acid. When you treat Bartonella, let's say you have someone, as a physician, you're going to treat them and you find, well, let's try one of the more commonly used drugs like azithromycin or clarithromycin. Sometimes it works and sometimes it doesn't. And what happens is Bartonella germs have genetic sequencing that allows them, when they sense this macrolide class of germs, they will actually turn on drug resistance genes and become drug resistant to this macrolide drug. Turns out, in the study, I can give you a reference if you're interested, if you treat with arginine, simple amino acid, it doesn't allow that genetic shift to happen, and you can maintain sensitivity to the macrolide drug, to the azithromycin. So that's a little trick that I've been talking about for a number of years once the study was published. So again, this is some interesting hope for people who have Bartonella. Problem with arginine, though, it can activate herpes viruses. So if you're prone to getting herpes of the lip, other herpes viruses, you have to be careful because taking a lot of arginine can actually stimulate them. So again, the disclaimer here that I've said again and again, the safety, usefulness, effectiveness of all this has not really been proven. But it's here to give you some hope that, yes, we have things we can do. And the more experienced clinicians who are doing a lot of treatment of Bartonella are starting to accumulate information and data that they're able to share. So that's good. So I'm going to be closing soon, so we have time for questions. But we have half an hour for questions. My advice, first of all, be mindful of Bartonella. Think about Bartonella. Remember what I said before, it acts just like Lyme, except that the nervous system symptoms are out of proportion to that of the rest of the body's symptoms. And the symptoms really are like as if you've been given supercharged doses of caffeine. You get this irritability and twitchiness and insomnia and panicky when you never were before. You see someone, again, a lot of antisocial behavior, you have to start to think of Bartonella. It's in the eyes, so forth. So keep a symptom list, keep a diary to look for patterns of illness, for treatment response that can vary, like I said, different from Lyme disease. Look for temperature elevations at unusual times of the day. And when you do testing, insist on this panel approach. Insist on not one test, like an IFA from Quest Lab or something. Go to a lab like IGeneX, get their panel, get the immunoblot, which is the best test out there, and the FISH test also for direct testing. Get the panel, get the full reading. And whether one is positive, one's negative, doesn't matter because you believe the positive. Important if you have Bartonella, you're dealing with Bartonella. As I said, it's not a political disease at this point. So keep up with the research because a lot of work is now being done on it. I just showed you, they're even trying herbs and different things. They discovered persisters. So keep up with the latest research, get your practitioner to consider these new options for treatment. Not encouraging anyone to do it yet because you don't have the data, but if you have a highly experienced clinician who's used these before and has gotten a feel for it, then you can discuss it. And finally, I've always said that I learn from my patients, and you should share your stories, not just with your diaries and with your doctor, but share your stories with everyone so that you can pick up patterns. Support groups and Lyme groups are really, that's the whole reason for being, to share information. You guys are the ultimate teachers, and we learn from you. And so we keep up what we call as a therapeutic alliance, that the doctor and the patient gets together and they discuss things and they figure it out. You've got to figure it out. So I'm going to stop at this point. I want to have time for questions and chatting, as they say. So I'm going to turn this back to the moderators. And we're going to see what kind of questions we have.
Perfect. Thank you so much, Dr. Burrascano. So I do have so people, if you'd like to ask a question, please put it in the chat. We do have one already. Thanks, Dr. Burrascano, for a very clear presentation of the literature. You showed Bartonella ImmunoBlot is 100% sensitive and specific in those that tested positive by other testing methods. I have found most people with classic Bartonella symptoms have not tested positive by any testing methods. Is there any clinical information on sensitivity and specificity between Bartonella ImmunoBlot and clinical Bartonella?
See, that's what I was talking about in the closing slides, that you need to do a panel approach, because if someone has antibodies to Bartonella, then you're likely to pick it up with the ImmunoBlot because it's a very, very sensitive specific test. to pick up antibodies. In fact, in the world of Lyme disease, Lyme immunoblots, the immunoblot is so sensitive that it can pick up even early disease when they say you can't pick up a serology. Well, it's not because you don't make antibodies early. It's just you don't make enough for the old-fashioned tests, but for these tests you do. So again, if you have antibodies in the blood, likely the Bartonella's immunoblot is going to pick it up. However, as you know, people with chronic Lyme disease sometimes have a defunct, weakened immune system, beaten back by all this infection and all, and sometimes you don't have good antibody development. So in that case, you're not going to necessarily have a strongly positive immunoblot, and you're going to have to rely on a direct test like the fish. Now, let me just talk about that in a second. Just as I said, there's a trade-off between sensitivity and specificity. There's also this kind of a yin and yang between antibodies being an indirect test and a test like a fish, which is a direct test. Because if your immune system is high, is strong, the antibodies are going to be there and you'll pick it up on an antibody test like the immunoblot. But because you have strong antibodies, you're going to beat back the germ and they're not going to be too numerous in the blood. You're not going to see them on a fish test. The reverse, though, is also true. If you have a weakened immune system, you may not pick it up on an antibody test, but you will pick it up more likely on a direct test because low antibodies mean the germs are there, free to flourish and multiply. So I really can't say in any one individual what's the sensitivity and not specificity, but sensitivity of the immunoblot is in any one individual because we don't know the stage of their disease or the immune status either. So the answer then is to use the two best tests, the two best ones that are the best is the direct test is the fish, and the best indirect test is the immunoblot. And you got to do them both. No, a lot of talking for simple questions. Sorry about that.
Are there different treatments for the different species of Bartonella or any research into different treatments for different species?
Nobody knows. And that's the job of all of you out there, not just patients, but doctors I lecture to. You've got to get the better testing done. You've got to get the better treatments done, and you've got to keep records, and then you got to publish it or at least report it at the meetings. So we learn from it. Just like in the world of Lyme, now this whole big thing about relapsing fever. Does that take different treatments than Lyme itself? Who knows? Nobody knows yet. Here in the case of Bartonella, we really don't know because now we're talking about 20, 30, 40 species, a dozen or more, which can affect people and do infect people. And then with Bartonella, it's not unusual to find patients with at least 2 or more species. So you really have a soup and you don't really know which is best. As I just showed you, you have the risk of biofilms and the risk of dormancy and the risk of both at the same time. So nobody really knows. Nobody knows. And that, again, not to beat this to death, but one of the reasons why people don't know is until now they didn't know they had Bartonella. Or if they did find some positive tests, they didn't know what species. So you can't really tell which species responds better to what drug. And it gets more complicated. You know, I could talk about this for hours. How do you test if a drug is good against Bartonella? You put the Bartonella in a test tube or a Petri dish and you put the antibiotic and see if it kills it. It doesn't work that way because Bartonella also live inside the cells. So you have to have a tissue culture system where you're actually growing living cells, and then you put the Bartonella in, and then you put the antibiotic in. Now, if you go to old textbooks and see what kills Bartonella, they'll give you a long list of things. Well, that was all based on things done in a plain old test tube, not in a living system like they have to do nowadays. So first of all, you have to find these other Bartonella species. You have to identify them precisely. You have to put them in a tissue culture. You have to try the different antibiotics. And when you're talking about 40 different species right now, no one has any idea. So it's a long answer again. I'm sorry, but you got to know the truth.
Next question, IV clindamycin and years later oral clindamycin along with rifampin and Tindamax really made the biggest difference in my Bartonella treatment. I never see clindamycin listed for BART. Have you heard anything?
You know, clindamycin is chemically very similar to the macrolide drugs like azithromycin. And so I conceive that we know that azithromycin can help to kill Bartonella in people who don't have that, you know, the genetic change in their Bartonella germs, what they're taking arginine. But they haven't reported whether that azithromycin resistance also affects clindamycin. So we don't know. Also, Tindamax is an azole drug, just like clotrimazole. This is an azole drug. So possibly this combination is somehow you hit on a magic combo. Again, we've got to report this.
Can Bartonella affect the prostate?
I think it can indirectly. Number one, obviously, because it goes to pretty much every tissue, muscle and gland and so forth. So if you have Bartonella, for example, in your tendons and in your eye, you probably have it in the prostate as well. But more than that, Bartonella does, as I mentioned many times, affects the nervous system. And sometimes what symptoms are attributed to an enlarged prostate is actually due to affecting the nerves that go through the prostate and affect urination. And just an enlarged prostate alone can affect those nerves. So if you have an infection on top of it, that can be double trouble. So I don't think there's enough evidence to say it will directly affect the prostate, but I can definitely envision an indirect link between the two, sure.
Would you say if tests are negative, that proves someone does not have Bartonella?
Kind of depends on the tests. And also, another thing we learned with Lyme years ago is that sometimes it's positive and sometimes it's not. So luckily now we have tests that are very specific. In other words, you believe a positive more than you believe a negative. Sometimes you have to do the test, and if you don't get a result, you wait a few weeks, you do it again. Some clinicians will treat with an antibiotic first and then repeat the testing, because sometimes it can release the bacteria or can release antigens from the bacteria by doing the partial treatment. So if you have completely negative tests and you have, let's say, an indirect and a direct test both, if you're still very convinced, wait a little bit and then do the testing again. And you know, that's the state of the art. You have to just try.
I have had the IGeneX test for Bartonella, but not the immunoblot. Why can't they make this available without a practitioner, since I don't have one currently and my insurance won't cover one?
Oh, I'm sure IGeneX would be happy to do that, but it's the law. The law is that you can't have a test that's, you know, you have to have a doctor prescribe the test. You can't not do it. The only exceptions to that are those home test kits like for pregnancy and things. But for a lab-based test like these, you have to have a prescription from the doctor. That's just the law. I'm sure the lab would love to sell you these.
So this kind of leads into the next question. Where can you get all these tests?
Well, that's actually interesting. You know, when you, let's say, go to the doctor, he says, oh, I'm going to check your annual checkup. We're going to do a blood count and check your liver and your cholesterol and your sugar and all that kind of thing. They give you a lab slip, go to the local hospital or the local Quest or LabCorp and you get it done and bang, you're done. Well, if you go to Quest and say, by the way, I want you to send my blood to IGeneX, you say, no way, Jose, we're not sending your blood to a competitor. So what do? Well, interestingly, we discussed this. What the lab has done is they've identified independent blood drawing stations that will actually draw the blood for you. And what you can do is you can request a test kit directly from the lab once you have a prescription, and they'll send a test kit to you. You bring it to the lab and they'll draw it. In my own case, I live on Long Island, which is like suburban New York area. And I could never get an IGeneX test for myself or my family through the local labs, but my local hospital for $7 will draw your blood, spin it down their machine, pack it for you and give it back to you to mail out. So there are a lot of different ways of doing it. So if you don't have a hospital lab that's willing to do what's called send outs, then definitely contact the IGeneX rep, that's Johan, or the lab directly itself, and find out if they have a service for you. In fact, I've even read that there are services like visiting nurses will come to your house and draw the blood. I'm sure they charge money for that. I'm sure it's not cheap, but there are all these different ways. And when you get a test kit from the lab, from IGeneX, they send you the whole thing, everything you need, including a return mailer. So again, in my case, go to the local hospital for $7, they do it for you, and then they pack it up. Then I have to take it to the FedEx drop-off box, and then it gets mailed out that way. It doesn't cost me anything because it's part of the test kit, but they do that for you. So, you know, again, there's always an answer to this. There's always a solution. You just got to know who to ask.
Yeah, you can reach out to me too, either through the Facebook thing or directly. And we also have locations on the IGeneX website. IGeneX.com has a lot of resources for everyone. So
Thank you, Johan.
you're welcome.
I developed mast cell issues after getting Lyme disease. Does Bartonella trigger mast cell?
Mast cell activation can come from a number of different antigens tickling your immune system. It could be anything from infections to heavy metals and toxins. So it's kind of a non-specific, exaggerated response of your immune system to something that's irritable and nasty. And Bartonella is irritable and it's definitely nasty. So I would definitely say Bartonella can be part of it. And in fact, the people who have the worst mast cell issues are usually those who have been co-infected for a period of time. And co-infection means Lyme and some other things. And the Lyme Bartonella combo is a tough one. So yeah, I'm sure it's related.
Thanks, Dr. B. To get the real immunoblot, is it only available through IGeneX, or do we have to worry about other labs using the name immunoblot?
Well, as far as I know, it's only available at IGeneX because they developed a test. I have no idea if it's patented or not. I have no idea, but they had to go and find these DNA fragments that they wanted and from all these different species, and then go and find a place where they'll cook them in a soup and reverse engineer the bacteria to make it. And it's a whole big process. So that's why you don't see other labs doing immunoblots. Also, you don't see other labs doing this for 40 different species. Like I said, you find one. So right now,
that's the key. If I can jump in,
yeah.
Actually, there are other labs that do have immunoblots or claim they have immunoblots, but we always like to say they're not all created equal. And like what Dr. B is saying, the recombinant proteins that we are using and the way we use it, no one else does. But, and hopefully maybe we'll be able to change our names so we're distinguished a little bit different from other people that try to say, oh, we have an immunoblot too. So it's a little confusing, but thank you, Dr. B.
Well, it's like saying we do a Western blot. So, a Western blot from lab X is different from a Western blot from lab Y, and definitely different from a Western blot from IGeneX where they developed the thing. So yeah, it's an immunoblot is a method, but the IGeneX immunoblot, which is why they capitalize the I and the B, by the way, that's kind of their trademark.
This sort of plays into this. I heard Galaxy has a reliable lab for Bartonella. What are your thoughts on their tests, and how do they compare with IGeneX?
Well, the lab test that they do is the droplet digital PCR. And as I showed you, the sensitivity straight out is about 30%. And it's a direct test and doesn't compare to the immunoblot, it compares to the FISH test. The difference is that the FISH test will pick up, or has the ability to pick up germs embedded in biofilms, whereas the droplet digital PCR hasn't been shown to do that. Not that it doesn't do that, but no one's ever looked, so I don't really know. When you break up the blood into microscopic drops to that teeny weeny size, I don't think you'll be able to get a biofilm into that. So my suspicion is that there's a lot of Bartonella and biofilm in the blood. It's not going to be as sensitive as a FISH test. But again, the whole theme of this is you need to do a direct test, which is either the FISH or the PCR, and an indirect test, which is the IGeneX immunoblot. So either way, you're going to look at both ends of the immune system, or at both ends of the yin and yang spectrum to do it. So that's what I recommend.
Would time of day of blood draw affect results?
Wow, that's a good question, and I don't have an answer. With Lyme disease, I did original research on that back, I hate to tell you how many years ago, back in the 1980s. Of course, I was only 4 years old at the time. But I found that in Lyme disease, I'm not talking Bartonella, but Lyme Borrelia, people would sort of get through the morning one right now, then they'd sort of function reasonably. And then by 2 or 3 in the afternoon, this big energy sag would hit, and they felt like the gas got let out of them. They just had to sit down, and that's when they had the low-grade fever. And we found that when doing blood cultures for Lyme, for Borrelia, that was the only time of day you really reliably got positive tests. So for some reason, there's this body cycle where in the afternoon, you get the low-grade fever and you get the germs released into the bloodstream. Now, does that happen with Bartonella? Nobody knows because nobody's tested it. Again, because until now, we haven't had good tests to figure it out. Bartonella, when it's in the bloodstream, as far as I know from what I've read, it's always in the bloodstream. It doesn't come and go like the Lyme germs do. But if you're worried about it, follow the fever curve. The Lyme patients felt worse in the afternoon. They had the fever peak in the afternoon, and that's when the germs peaked. So if Bartonella peaks in the morning, again, keep your temperature record and look, and that's when you draw the blood.
What is the lifespan of the Bartonella when reproducing?
You can't answer that because now they know Bartonella has these persisters, and Borrelia persisters, they can last months, if not years, before they wake up and cause trouble. We don't know about Bartonella. We just know they can become persisters, and it has to do with their environment. Can they live weeks? Sure. Months? Absolutely. Years? Probably. More than that, I don't know. Nobody knows.
Thank you for the great information. I struggle with a lower extremity rash that has small red spots, sometimes in a small half-inch circle or oval shape of red spots. It doesn't look like your picture, but I suspect Bartonella. Can skin findings look different from the image?
Well, you know, skin is a very interesting organ. Think about skin. Number one, it's the farthest away from your immune system because it doesn't get blood to the very end of it. And the second thing is it's cool. And these germs in general like a cooler environment. They don't like fever, they don't like heat. So these germs tend to accumulate in the skin. And Dr. Moziani, who's a big name in Bartonella, has developed a method. It's in his lab now. It's not commercially available, but he's still researching it and hopes to be available this coming year. We actually do a simple skin punch biopsy and send it to him. And he uses a method like FISH to find these fluorescent germs actually in the tissues. Now, you know, I've done a lot of lecturing on relapsing fever, and some relapsing fevers give a mottled, patchy red rash that doesn't look like a Lyme rash at all and doesn't look like a Bartonella rash at all either. So, you know, you go where the money is. If you have something funny in the skin, you get it biopsied. And the trick is to make sure you have the biopsy sent to a lab that knows what to do. If you're considering it, have your physician contact Dr. Moziani directly and see if he'll do a sample for you. The other thing is, IGeneX will process tissue samples by PCR, and you know, tissues don't have the inhibitors that blood does. So PCRs and tissues are really very sensitive where they're not so much in the blood. So you can go to IGeneX and say, here's my skin biopsy, please test it for, you know, relapsing fevers, for other Lyme Borrelia, as well as for Bartonella. And that way you'd get a picture of not just one, but several germs.
Are proton pump inhibitors needed along with antibiotics to treat gastritis associated with Bartonella?
They usually do. Go back and give a little history. I mentioned briefly that Bartonella can cause an inflamed GI tract, like a gastritis, very similar to what H. pylori does with the cause of ulcers and gastritis. And they found in treating H. pylori, you need a combination of antibiotics, and it seems to work better when you use a proton pump inhibitor like as a third drug for it. And the thinking is that it allows the antibiotic to penetrate into the cell better. Now, Dr. Moziani, again, who's a maven on Bartonella, has also recommended this and has for a number of years. So not only will the proton pump inhibitor soothe the gastritis, at least temporarily, if it has a chance, it might actually help the medication work better. So if your physician's willing and you don't have a side effect from it, I would say to do it.
Can people from Europe use IGeneX?
I believe so. Johan, do you have any information on that?
Yeah, they can. We do take samples all over the world. They have to use a different form, so they should contact us directly. And there are some import restrictions too from certain countries because you know, bodily fluids, etc. But from Europe, we do take it in most cases. Just contact the lab first. Issue is also stability, how long you do it. So some of the tests, specifically the T-cell IgX spot, is probably not really good because they need to reach the lab within 48 hours to be stable. So yes, the short answer, yes, with some restrictions, and contact the lab or me.
Thank you. Thank you for telling us about what looks like scabs can be attributed to Bartonella. I've been asking about this symptom to many LLMDs. They have not known what it is. If it is Bartonella, we need to get the message out to as many doctors that are unaware.
Well, you know, it's sad and interesting at the same time, because that lesion, bacillary angiomatosis, they're called BA for short, that's been described as part of Bartonella for decades. And this new thing about the tracks and stripes, that's only recent and only very recently proven. So part of medical school, I mean, I'm 148 years old and I learned this in medical school. So it's not new information.
Have you heard of phage therapy for Lyme and Bartonella?
Oh, that's experimental. What is phage therapy? Phages are viruses that infect bacteria. So it's been thought that if you can find a virus that will infect the Lyme germ or the Bartonella germ or whatever germ you're going after, maybe that's a way to kill it. So that's exciting, but it's not ever something anyone has ever done. Certainly not for the tick-borne diseases. In Europe, there's a thing called a Felix phage test, where they actually test usually the urine to see if you have these phages that came from Lyme or came from Bartonella. I don't think they do Bartonella, I think they do Lyme. And that test is only being rolled out now. Some claim it's great, others say it's not great, so we don't know yet, it's still too new. But anyway, in terms of treating it with the phages, that's, I don't want you to say science fiction because that's like, dissing it a little bit. It's just, if it's going to work at all, it's not been proven. And if it's going to work at all, it's going to be probably years, if not decades in the future.
And what foods should you eat and avoid Bartonella? Is there anything specific in terms of, I know because you're a nutritionist, maybe you have some thoughts about that?
The problem with any tick-borne disease is that they're chronic and they cause chronic inflammation. And chronic inflammation itself does a number of different things to the body. Number one, it affects the gut microbes, which is the root of your immune system. And that has indirect and direct effects on your hormones, your nervous system, your immune system itself, your liver function, your detoxification pathways. So not just specific for Bartonella, but anyone with chronic disease, especially chronic infectious disease, you have to be on specific clean diets. You want to minimize the toxin burden because detoxification pathways stop working as well as they normally would. And you can build up all sorts of things that came from the environment, pesticides and glyphosate and heavy metals and benzenes and volatile organic compounds. I mean, the list is endless. So some of those things you can't avoid. So the ones you can avoid, you have to. That means eating a clean diet. In other words, if you buy something that has an ingredient list, don't buy it. You get a piece of broccoli. There's no list of ingredients on broccoli. Hopefully you get it organic. So as much as possible, organic food, as much as possible, non-processed food, as much as possible, you avoid sugars and fructose because that, again, alters the gut microbiota and affects the immune system too. So we're talking basically about Mediterranean type diets, clean diets, organic diets, avoiding food allergens that are common, wheat and wheat products because of the gluten, dairy products because of the proteins in that, and soy products, and even the hidden ones. Now, even if you are not known to be sensitive, for example, to gluten, it's still a stress on the system. And if you're very, very sick, it's usually wise to limit that or eliminate it totally. And the sad thing about these food sensitivities, they don't cause rashes and hives, they just cause you to feel horrible. And if you stop these completely, which is hard to do because they're hidden in a lot of different things, let's say you stop it completely, it can take as long as 2 to 4 weeks before you notice a difference. So it's very hard to sort out. And the idea is to find a local Lyme physician who's literate on this and has a knowledge on it, or a dietitian who works with this person to help you figure it out. There's some books coming out. I can't tell you more details about it because I'm helping review it, but there's a book coming out that goes through this in great detail, so stay tuned.
Okay, time for 2 questions left. First of all, have you heard of SOT therapy for Bartonella?
I've not had any experience with that, so I really can't give you any background, sorry.
Perfect. And then the last question here. So you had mentioned that Bart doesn't seem to have the same sort of politics surrounding it as Lyme. Do you see anything on the horizon for changing the politics of Lyme research?
Oh, absolutely not. That's never going to change, at least not in my lifetime or any of your lifetimes. Not going to change. I mean, the top stars and celebrities and everyone in the world, they get Lyme disease and nothing changes. You have class action lawsuits and nothing changes. You have NIH and government hearings and nothing changes. I testified before the Senate back in like 91 or 93, I forget even when it was, nothing changed. And the things I complained about then, you could read it. It's exactly what's going on today. So I don't think it's going to change. So that's the sad thing about it. And we have to just do the best work we can and use your local Lyme physicians who are literate and, try and get around the politics if you can.
Wonderful. Do you have any last final imparting words to us as we sign off tonight?
Well, like I always tell my own patients, that things happen for a reason. And it's up to us, the medical community, with your help to try and figure it out, because things happen for a reason. If you're not well, you just got to keep working on it until you find out what the cause is and then work on the ways to fix it. So there's always hope, and everyone can get better. It just takes time, work, and a little bit of luck. So I don't want the things that I talked about today to scare people. I think it's actually hopeful that we finally have better tests. We're recognizing dormant things. We're recognizing co-infections. We have ways to test through biofilms. I mean, a lot of things are happening, and it's done without politics. So I think this is really pretty cool.
Well, Johan, thank you for joining us tonight and for helping share information about IGeneX. Dr. Burrascano, thank you so much for all of your years of service to the Lyme community. You truly have been a pioneer for so many people, and I'm sure you have saved many people's lives. And we thank you for taking time out of your very busy schedule to be with us tonight. We truly do appreciate it. I hope that all of you have a wonderful week. Enjoy this beautiful weather, those of you who are here in Minnesota. As always, if you need anything, feel free to reach out to us at the Minnesota Lyme Association. We're just a group of volunteers, but we're here to try to help in any way that we can. So I hope I see some of you next Tuesday at our support meeting. And until I hope you all find the right answers and find something to make you laugh every day. So thank you again, Dr. Burrascano.
Oh, thank you for having me and welcoming me into your homes. Have a great evening, everyone.
Bye now.
Bye. Thank you.
Thank you.